enjoying the snow. If you don't enjoy the snow, I'm sorry for you. Maybe it will melt. How about that eventually? Okay, so I have two topics today. In terms of one about the COVID, the other one, we're going to talk about cancer incidence and the new study that just came out showing pretty dramatic problems, which I want to put in perspective. I chose to talk about that study because I anticipate that we're going to hear a lot about it, and we're going to, so I expect that you guys can have a lot of questions, and also there's going to be, and also the way I position the results of this study, or the way I'm questioning the sort of the conclusions of what media is making out of this and giving you my take on this. Okay, but you know the drill. COVID goes first. Feel free to drop the questions. Kind of immediate thing is the CDC officially now sending the kits for free again. Interestingly, they for some reason now sending 2 kits instead of 4. I know they used to send 2 boxes of 2. I just ordered and we just got 2 kits, but I strongly suggest you stock up. My recommendation, have at least 4 kits in any given time at home for a family of 2. If you have a family of 4, try to have double. So basically have 2 kits per person at any given moment. Why? Well, because despite what you're hearing on the news, everybody is like, no, the GN1 is like easy to test, should have no failure rates. I have not seen any single study claiming that that is true. It's all expert opinion saying that there's no reason to suspect that the new variant is going to not being able to get tested. I am questioning this because I have numerous patients who were classic symptoms and test negative. And I don't know what that means. I can't comment on that because we also had lots of patients, including some of our staff, who got sick and they're test positive. So the problem is because CDC is no longer tracking any statistics. If you go to their website, the last thing you're going to see is in November 2023. And so they're not updating it enough, and they're not giving actual legit answers to some of these important critical questions. Now, I have found this website on my own. I don't know the quality of this, so I'm just going to put this in. It also looks like it uses some free advertisement, so I'm presuming that that's how they make the place, the website survive. It is apparently tracking all of the numbers everywhere. This particular one I copy-pasted right now in the chat tracks just US. There's one particular advantage there, and they track it by states. And if you look on top of the website, they actually say that they're updating it every day. Again, I don't know the quality. I have no way of easily check what is this, but they providing ongoing numbers by a state, which I find relatively important to try to periodically keep an eye on. It's interesting, if you scroll to district, they comment that we currently have active 385 cases. You have to sort of obviously question how true that is, but nonetheless, it's at least something. From what we see in the clinic, lots of cases. People who end up traveling, at least half of them comes back picking it up somewhere. And that's one of the important points here. So there was a recent study showing that at least with the Omicron and with the GN1, particularly the 2, it appears that even though it's still quite easy to get the virus, meaning if you're in the space with someone, you're going to get it. Very high probability. But it turns out that what's important is the length of exposure. And it appears to be more important than how you're being exposed. What that means is that if you're going to a shop and it's not overly crowded, let's say you're walking into a standard, I don't know, where you guys, Safeway? I have Safeway close, I'll just use Safeway. So you go to the Safeway, you walk in, and usually it's a big store, right? You have a lot of space, people walking around. I mean, they may be coughing, sneezing. If you don't want to wear a mask, I will tell you, I don't think it's very likely you're going to get COVID in the Safeway, because you're moving constantly and you're not, well, unless you're shopping for 3 hours, okay? If you're shopping for 15, 30 minutes, the chances that you're going to get are very low. Why? First of all, somebody would have to be close to you for the time, right? Because it's just a big open space. It's almost like outdoors. If you consider that somebody in the other corner is sick, for them to pass it on to you, it's not really possible because you're too far away from them. So you'd have to be close to someone for a prolonged period of time. So the only way I think you can get COVID during shopping, if your significant other with you is having a COVID and sneezing and coughing on you, and anyway, I'm kidding. So, the problems are, I think, is when we travel. We're in a closed environment, a bus, a train, an airplane. Remember, airplanes stopped using HEPA filters, most of them. So the buses almost never, they don't even have any air filtering system. I don't know about the trains, but I wouldn't trust that either. So those are when you're in an enclosed compartment with the people you don't know, or just number of people, that's, I think, where you must wear the mask. It gets more complicated when you're going to, say, like a concert, and there's a whole bunch of people together. I would definitely wear a mask if I were you. Reason I'm saying it's a bit more complicated because, again, it also depends on how big the place is, right? So I will tell you where I'm not wearing a mask. We're going skiing. We're going to a lodge for 15, 30 minutes to eat. I'm not wearing a mask. Well, first of all, if I eat, how am I going to wear a mask, right? So if I cover the nose, but I'm chewing, it's just stupid. It's just not going to work. Second of all, like, it's skiers, right? So presumably, if you have a COVID, you're probably not feeling all that great. So chances are you're not going to end up on the slopes for obvious reasons. So, so this is how I'm starting to judge. I'm starting to be very selective at where I'm masking. I'm masking on a transit, on any public transit. I'm masking in the doctor's office. I'm masking when I'm at work, even though I see that we took our older kid to the orthopedic surgeon. We need to evaluate something. And they were not masking, but they were asking patients to mask. I was like, what? How's that making any sense? But anyway, so, but it's pretty obvious that most of the institution bringing back the implementation of the masking. So MFA, GW is still, I think, figuring out whether they want to do it or not, but they're recommending. So I'm wearing mask when I'm in office, and I recommend when you go to a doctor's, because you're in a doctor's office for a while, you don't know who was there just before you. They're not going to clean surfaces anymore between the patients. There's just higher risk. So okay. Now, off to long COVID, fascinating study. If you're reading news, you've probably already seen it. I'm gonna put this. It's a Nature, and it's actual Nature journal putting the. It's a nature.com, so it's their official website, so I can trust this rather than some news. It's in a link. But if you go to NBC, they have a video about this study, which is really nice, actually, and then they're interviewing a lead researcher there. So we're getting to better and better understand the sort of what drives the long COVID. In essence, what this study says, we now have a much better understanding why immune system is so dysregulated, why people with long COVID end up having recurrences of old viral infections like hidden Lyme, hidden mono, Epstein-Barr virus, hidden herpes infections. It turns out that some of the immune responses, particularly that are T-cell driven, are failing. After prolonged illness, the body is unable to reconstitute the immune response. I'll talk about what I think it means and what we're going to do about it. And so, and they have markers for it. Like, there's one marker they call CD41. We haven't tested this marker, but I'm assuming it's going to be quickly rolled into the clinical practice. I don't see any problem with that. It's actually one of the markers. CD markers are commonly tested, not CD41, but some other ones. And so I expect that we will start seeing that being rolled into the clinical practice. I don't know, 6 months, I'd say that's probably realistic because it's already an existing marker. So it's not going to be all that difficult to figure out how it will be implemented. So if it's already there for research and occasionally used by some specific clinical fields, to make it into mass production probably be not all that greatly difficult. So it'll probably be useful. It's interesting that they're particularly saying that because there is a certain immune dysregulation, the drop of a chronic immune system, they didn't really discuss possible treatments because, they mentioned some biologic drugs, but really we don't know. Of course, we in this group do know how many immune boosters naturally we have, right? So it seems to me that the cocktail that we were giving people for COVID probably should be prolonged instead of for 4 to 6 weeks. I'm going to now recommend we'll do 3 months. Everything that we've been giving for acute COVID has a pretty significant immune boosting properties, things like quercetin, things like N-acetylcysteine, things like, well, even turmeric, which is anti-inflammatory. So there's a lot of things, zinc. So all of those things are generally designed to be boosting immunity. Now, will I be risk stratifying patients with acute COVID, knowing this data, to who's more likely to going to get long COVID? We already knew that people who had other viral chronic infections like EBV, particularly, well, like patients with basically, let's say, fibromyalgia, chronic fatigue syndrome, a lot of these patients have the chronic mono or past mono syndrome or post-viral syndrome. They're at much higher rate or much higher risk for that. So I don't think I'm going to do that. It's not giving me a different way of thinking just yet. If that particular marker going to get unrolled, I think it will probably happen. I'll probably have a more specific tool. But the fact that we're going to be boosting a lot of people's immunity after COVID when there's a high risk is going to be a longer process. We do see periodically people who are very clear. They would say, look, I had an acute COVID. I recovered just fine. A couple months passed by, and now I'm like getting slowly sick, and everybody telling me it's not long COVID. And of course, it's long COVID, right? And this study explains why, because failure of a long-term immune response often takes time. It's not overnight. Anybody who works enough with HIV know that immunity waxes and wanes based on all kinds of parameters in patients with a chronic HIV infection. So that's not surprising. And again, it's an explanation. The study is explanation. I don't recommend for you to read the actual study. It's very technical, but do read the review of the study in Nature. I think it's very well written. It's quite easy, probably about 10-minute read or less. So that's all about COVID. Let's do Q&A, and then we'll see how much time we have for my topic on the cancers, because it's not directly related to COVID at all, I think. Actually, I'm sure it's not. Going with a friend to test drive cars. Do you think? That's a great question, CJ. You know what I would do? If I walk into the dealership and there's not a lot of people, you're going to be probably interacting with maybe 1 or 2 agents. I probably wouldn't wear a mask. Because even with that one person, you're going to be inside the car for maybe a certain period of time. I mean, it's a statistics, right? If you're concerned, sure, wear the mask. But this is a good example where I think the number of exposures is limited, because you're not going to be driving the test car, not test driving your car with like 20 people in it, right? It's going to be most likely your friend and a one agent salesperson. I mean, what are the chances that that person is currently sick? Yeah, there's a chance, but that's the way to think nowadays, I think. Think about probabilities, think about always carry the mask in the pocket, because you walk into the dealership after what I just told you, and the person sitting there is sneezing and coughing. Well, guess what? Put the mask on, right? So certain things should not be very difficult to sort of imagine. But again, that's the way I think. Okay, Linda's asking, is there a way to test for micro blood clots in, that's another great question, in all or any part of the body? Okay, so the question is critically important and very difficult to answer very well. I will tell you that there's one test that we do a lot. It's called fibrinogen. Oh, spelling. No, that's not. In order for me to spell right, I have to see the word before I know if it's correct. I'm still not sure if it's correct, but it's something like this. Somebody can Google and put correct spelling in there if you don't mind, guys. Thanks. So fibrinogen measures one of the way of blood clots. it measures the types of clotting that's related to the inflammatory response, and it's sometimes very useful. It's actually the only test I check after COVID. Why? Checking direct clotting fractions, which we call PT and PTT, is kind of useless. It's never abnormal in these patients. Why? Nobody fully understands. So, Linda, what you're trying to point here, there could be a clotting in the small vessels, which ends up causing a massive long-term problems. But if you test general blood, you're not going to find that because it only occurs in the small vessels. The thinking that it's because there's an inflammatory response at that point. And it is happening. There's no question that the clotting is a big problem of acute and possibly long COVID. Oh, wow, look at that. Correct spelling. I'm surprised. Okay. But fibrinogen is useful. It's a simple test. It doesn't require anything. It's covered by every insurance. If you worry about something, I think it's reasonable to ask your provider to check for it. About a year ago, the brackets of normal fibrinogen changed. I don't know why. I've tried to figure it out and I failed. I still use my own older brackets, so anything above 400, I'm start getting concerned. I think the new bracket goes all the way to 500, if I'm not mistaken. So, I also look at the personal situation. If I'm worried that somebody is at the high risk, I may start treating them when their fibrinogen is even at like 410. And the way we treat this is I don't give anticoagulation unless there's a real documented clots. Elevated fibrinogen to me is not going to indicate there's a certain clots. If you have an acute problem, so let's say you have an acute breathing or a potential clot because there's swelling in the leg, that's not what I'm talking about. That's not what Linda is asking. Linda is asking about microclots. Microclots generally don't produce symptoms, but they can produce a kind of a weird long-term functional disabilities. Fatigue, cold, kind of clammy extremities, inability to exercise because you start getting achy in different parts of the body. So those are some of the kind of a poorly understood symptoms of this issue, what we sometimes describe as a microvascular clotting. Again, is it a big problem? I think it is, but it's poorly understood. And more importantly, because it's poorly understood, it's almost never treated. People ask, well, should I just take aspirin? Well, no, because aspirin doesn't necessarily treat this very well. Aspirin is very good to prevent big clots, but it's not going to necessarily resolve this problem. Fully not clear why, by the way. It is an anti-inflammatory. It should resolve this better. It is probably sometimes used. I don't. Part of it is also because, when you don't have evidence of efficacy, giving something that has higher risk would be a little problematic. So I use a couple of things. I bump up fatty acids. So I make sure that people take enough fish oil. And I do love to use what's called nattokinase. Let me spell it. It's I think I'm on a spelling parade today. I think that's correct too. Somebody check that if you don't mind. So natto is a fermented soy product or extract from fermented soy. It's believed that actually one of the reasons why there's this Chinese paradox, or in China study, they demonstrated that the people who ate fermented soy had very little risk of cardiac events, and the big believing is that, at least in part, that this may be related to the fermented soy. It's just food. Now, we in this country don't really do the fermented soy as much. I think it's a most common food. Fermented soy is a tempeh. I mean, some people do eat it, but I generally give it as capsules, not very expensive, easy to get. And it's also good because there's not a lot of data. In fact, there is no data of significant increase of bleeding with natto. There are some other products. There's an extract from worms, from like earthworms called baluk. That's a much more potent product. That one we use when the clots are documented, and I don't want to go there because it starts to get really, really complicated. It's a little out of the scope of what I want to talk about. Okay. No, you will not see any microclots in the brain. That would be, well, you could. there could be a comment on the microvasculature or on, as what sometimes they say, white matter. Usually it doesn't, it's kind of hard, Linda, to translate what they find on MRI, whether or not it's true clotting or is it some other problem related to vascular. Because remember, you could have other reasons. You can have microvascular disease that is not related to clots per se. There could be inflammation in the vessels. There could be other issues. So not easy to answer. Okay, let me tell you about this whole thing with the cancer study in the last 5 minutes. If you want to listen to, and look at the actual study, listen to the longer presentation, feel free. I'm going to post the video I just did on my YouTube channel there in the chat. It's following the news. It's a big article in CNN that was featured, I believe, a week ago, maybe 5 days ago. So as you know, I'm trying to keep it current. The actual link to the study is in the YouTube channel, in the CNN link inside the article. I didn't post it separately. I didn't feel it was critical because it's a you know, any study that deals with observation and general assessment of data is not as essential because the methods that are implemented are different. So, you know, you do have to kind of question when the study is not controlled at all, the value of this. But this are the typical kind of what is going on currently, right? So they just look at the total number of incidence and prevalence of all the cancers, and what they find that basically not only incidence of most common cancers have been slowly rising, but it's really moving to the left. And that's the scary part. What do I mean by that? People start to get cancers at much younger age. So they looked back, and this is intuitively why I really grabbed on to this study, because I see this. We see this in a clinical practice. When I was recently, we had a 28-year-old woman with a stage 4 breast cancer, and I was reflecting on this, and I'm like, this is not something I used to see when I was in medical school. And so the study basically is saying that shift is big. If nothing changes, we'll start seeing cancers that are considered old age cancers like leukemias, prostate cancer, and in 30s and 40-year-olds on a daily basis. And the article kind of just avoids the whole topic, what is going on here. They basically kind of just saying, yeah, but the good news, we're treating this cancer is better. And my response to it, yeah, but like, who would like that treatment? Do you? Like, if you're a journalist writing this article, would you like to get the breast cancer treatment? It was a woman. And so, you know, to me, it's in avoiding the whole reason, sort of. They're saying, and by the way, we don't know why it's happening. I'm like, bullshit. We know very well why it's happening. We know it's all environment. We know it's a tremendous pollution and the amount of toxin we exposed to. And, you know, if you think about those of you who are in 60s and 70s, go back to when you were a child, 60, 70 years ago. The amount of load of the environment pollution was probably less than 10% what you're experiencing now. And so people who've been born back in the day, yes, there are some things like, you know, amalgams, mercury fillings that were horrendous. So certain things gotten improved, but overall total number of chemicals, at least in US, that we exposed to increases by 1,000 per year. Only 5 chemicals out of 1,000 get annually removed. And nobody knows out of this 1,000 chemicals which ones are safe and which ones are not, because, you know, EPA and government has no responsibility to really check them. That's not preview of them. The burden of proof is after market, not before they get put on the market. It's very sad, actually, because that's not what's going on in Europe. Europe prohibits placing of any chemical without proven safety on the market, but in US we don't have that. So remember, I mentioned non-toxic book by Ellie Cohen. We have brought her to our podcast. I think we're going to do that again. I think she's about to finish another book, so when she finishes that another book, I think we'll bring her in to kind of talk a little bit more practicalities, you know. But so where am I practically going with all this story? Remember, we had the detox talk. So do try to detox what you can and pay a whole lot more attention to your exposures. Okay. So if there is a chance, you know, that you're exposed to something, try to get rid of that exposure, even when you think it's not so easy. Why? Because they're probably, for each chemical that you know you're exposed, there are probably 10 you have no idea and you have nothing you can do about it because you just don't know what you're exposed to. Question is, some of this newer, expensive functional toxicity tests, are they worth doing for everybody as a screening? I used to say it's just too much and too complicated, but I'm potentially going to start changing my opinion on this topic. I think what I'm going to do is, in an upcoming year or two, I'm going to try to ask this question to some of the leading scientists and get some basic idea who and how should be assessed. So could our food also have impact? There's a question just to me. Fast food. Well, yeah, so the food definitely has an impact, right? So if your food is pro-inflammatory, for sure. The thing is, though, that our food has actually been improving, Kathy. The quality of the food and the fact that less population eats fast food than 20 years ago, we removed trans fats almost completely. There is a culture of healthy eating that's been rapidly increasing in the US, despite the fact many people still eat a lot of crap. But if you look generally, our food is getting a little bit better. Organics are dropping in prices. Organics are much easier to access. You can find organics now in every store, not just in a whole paycheck store or whatever you call your whole food store. And, you know, and the prices are dropping. So they're getting more accessible. I completely agree that fast food as a principle is still a huge problem. But I think that the issue is bigger. Food, of course, is a big part of it, but I think the overall issue is larger. You know, we are seeing increased amount of pesticides and herbicides continuously spewed into environment. We are seeing other issues. It's not just those. I mean, you know, you start questioning whether other sources of toxins, EMF and other things, which are also big deals. So anyway, I think I'm out of time. Janet correctly brought Dr. Yager onto the screen so that she can take over and lead us into a really important aspect, which is stress as toxin. If we don't know how to handle it, if our body is unable to process it, it will cause the same issues. It will become pro-inflammatory. It will feed into the same total negativity and total burn of toxicity. So let's learn from the wise one what we can do today and practice a little bit. Perfect transition, huh? Eileen, we can't hear you. You're muted. Still muted. There we go.
Okay.
Perfect. Thank you.
Thank you, Misha. What I'm going to do today is first clear my throat. Excuse me. The world is so full of stress right now, and in our personal lives and in the political life, everything is a mess. And whatever we can do to improve our own functioning with regard to stress helps. So what I did was to gather 5 of my favorite stress reduction practices. They're short, they're easy to do, they're safe, so you can teach them to others if you like them. And the only time you can't do them is when you're driving. I've sent the handout to Janet, and at the end of this session, she will email the handout to everybody who's here today. So you don't have to take notes. We're just going to do them. Okay. The first one is actually quite short, and it's a lot of fun. It's called the 5 Senses Stress Reducer. And this is a really good practice to reduce worry and anxiety quickly. So sit with your back straight and feet uncrossed on the floor, unless you're sitting on a cushion on the floor. And rest your arms either on your lap or the arms of a chair or a piece of furniture. And with this particular practice, the first 2 sections need to have open eyes, but in the 3rd, 4th, and 5th section, you can close them if you'd like. So, first thing, stop thinking about the worry and anxiety that's in the back of your mind or in the front of your mind, and focus on your body. Just tune into how you feel. Now, say out loud 5 things you can see now and look at them, focusing briefly on each one. Now, you're all muted so that if you say it out loud, it's not going to make noise for someone else. Look around your environment. 5 things you can see now and look at them, focusing briefly on each one. Down. There. Okay. The next part, say out loud 4 things you can touch now and touch them, focusing briefly on each one. And as you concentrate on each thing, put your full attention there. Touch. Okay. Next, say out loud 3 things you can hear. And if you like, you can close your eyes if you want. And if you can't hear 3 different things, your breath can count for this too. Say out loud 3 things you can hear. Okay. The next part, again, you could do this with your eyes open or closed. Say out loud 2 things that you can smell now. If there aren't 2, you can imagine smelling something good. And finally, say out loud 1 thing you can taste now. Taste what's in your mouth. If there isn't a real taste, then imagine tasting something delicious. In my case, it would be chocolate. Say out loud 1 thing you can taste now. This practice focuses your attention on physicality, allowing you not to think about the anxiety or worry that you are having. And it's safe, so you can teach it to your child, to your family, to your friends. And let's just sit quietly for 1 minute, which I recommend doing after any kind of practice that you do. When you finish, sit for half a minute or a minute, breathing quietly, and let your body absorb the relaxation that you were trying to get during the practice. If you leap up right away and go on to your next activity, it's very jarring to your system. So whether it's meditation or breath practice or yoga stretch, whatever, give yourself up to 1 minute just to sit quietly and absorb it. Okay. Now, the next practice that we're going to do is a breathing practice, and it works so well to reduce stress that it's now taught by the military to people who need to know how to quickly de-stress and focus well. For example, the Navy SEALs or the equivalent in the other branches. And you may be aware of this because I think it's a yoga practice. I didn't learn it as a yoga practice, but it's called the box breath or the square breath. So sit up tall, close your eyes. All of these practices are better if your eyes are closed because you can focus on the feelings better. But if that's not comfortable for you, then keep your eyes half open, staring at something in your lower field of vision in a blurry way, so that as you're not focusing on something, but your eyes are open, looking down. But if you can close them, that's even better. Okay, so sit up tall, close your eyes, go inside. And we start the practice by blowing out the stale air through your mouth. Now, before you do it, I'm going to read what we do, and then we'll do it. So you'll blow out the stale air, and then through your nose, you're going to breathe in to the count of 4. Then you will hold your breath for the count of 4. Then you breathe out to the count of 4, and then you hold for the count of 4. So this is like a box or a square. As you exhale, drop your shoulders. That's a very, very good way of relaxing your body and your mind. Okay, we're going to do this 7 times. Use a comfortable count, which is approximately 1 per second, like in, 2, 3, 4. If that's not comfortable for you, then adjust it to something that is, but you have to use the same speed for all phases of the square breath. Okay, so close your eyes. Start by blowing out the stale air through your mouth. And now through your nose, into the count of 4, hold for the count of 4, out to the count of 4, dropping your shoulders, and hold for the count of 4. And repeat this 7 times. I'll tell you when my 7 are up. Last cycle. Okay. Now sit quietly for a minute, breathing at your own comfortable rhythm. Keep your shoulders lowered. Okay, now open your eyes and notice how you feel. Now, this is a practice that you can repeat if you need to. Again, you don't do it when you're driving. Well, actually, all of the practices that we'll do today, you can repeat as often as you need to. But you have to pay attention to what you're doing. And if extraneous thoughts come in while you're doing any of them, don't get annoyed at yourself. Just recognize that you're thinking about something else and go back to the breath or whatever it is that you're focusing on. Okay. Okay, the next practice is called relaxation response breathing. It's actually one of the mindfulness meditation breathing practices. So some of you may be familiar with it. Make sure you're not disturbed while you do this. Sit on a cushion on the floor, cross-legged or in a chair. Should be a comfortable position. Your back should be straight. Don't lean on the wall or the chair back if possible. And again, you can either close your eyes or keep your eyes slightly open, looking at the lower part of your field of vision unfocused, and rest your hands comfortably on your thighs or your knees or the arms of a chair, etc. Now you're going to breathe in through your nose. You don't need to breathe particularly deeply or slowly. And you breathe in, and then as you breathe out, you silently say to yourself the word peace or calm or one. You pick one of those three words. Use the same word for the whole practice. For example, it would be breathe in, breathe out, and think peace. Breathe in, breathe out, and think peace. And when your mind wanders, you gently return your attention to the breath. Don't be surprised if thoughts intrude. They usually do. Okay, so let's do this for a couple of minutes. Close your eyes or look in your lower field of vision. And the three words, peace or calm or one. Sometimes I've given the word relax, but I think a single syllable word is better. And I'll tell you when the time is up. Okay. So become aware of yourself. Feel your feet. Wiggle your fingers and toes if you like. Take a deep breath. And as you breathe out, open your eyes, come back here and sit quietly. Now, this practice is recommended to do between 2 and 10 minutes usually. We just did it for 2. And if you like the practice, you can try variations of it, like thinking your word on the in-breath instead of at the out-breath, or both in and out breaths. Your breathing may slow down while you do this. You may feel calm at the end of the practice. It's a very good stress or anxiety reliever that's known as focused mindfulness breathing. It's very relaxing. And if you prefer, you can also drop your shoulders with each exhalation. Somebody just asked a question about why is it important to have your back straight? It's to allow the breath to go in and out of your lungs without feeling cramped. It allows the energy to go up and down your spine. And if you're an advanced practitioner, you can do meditations lying down, but very often you get relaxed and you fall asleep. So this is a position that keeps you awake, hopefully. But keeping your back straight helps the energy go up and down, and it allows your lungs to fully expand and contract. Okay. This next one is also, it's a lovely one. It's called Filled with and Radiating Light. So let me read it first, and then you'll do it. The first thing you do is breathe out and feel yourself surrounded with white or golden light. Imagine it. Then you inhale and feel yourself as an empty chalice with light pouring into you, filling you as you continue to inhale. When you have finished inhaling, hold your breath and feel your heart like a sun which is radiating out. Radiate light 360 degrees out from your heart into the world. This can be either white light or golden light. We do the practice slowly, feel the light around your body, and after each breath, after each repetition, be aware of beams of light radiating from your eyes. Be aware of the light radiating from your heart and light above your head. So you're filled with and radiating either beautiful white light or beautiful golden light. So let's start by breathing out, feeling surrounded with light, and inhale, feel the light pour into you, then hold your breath, feel your heart like a sun and radiate the light out to the world, being aware of light coming from your eyes, above your head, and your heart. Okay, last cycle. Now sit quietly, breathing at your own comfortable rhythm, and just being aware of the light surrounding you above your head, in your heart, coming out of your eyes like beams of light, and just surrounding your body. One thing I will say is that I wanted you to get a taste of these practices, so we really didn't have much time to do any one of them. But when you're practicing these at home, you can spend more time on them, especially if you find a couple that you really like. The other reason I always give more than one is that some people love certain ones and hate others. So this way there's enough of a choice that hopefully you'll find at least one that you really like and maybe more. And just spend as much time as you want. These really are safe practices. Okay, and let's finish with my very favorite. I used to do this in my meditation classes. We would do the practice for 15 minutes, and it sort of takes you to another place. But we don't have that much time now. So this is called sitting in a globe of light. Sit upright, close your eyes, inhale through your nose, visualizing white light descending from the top of your head down your spine to the heart as you inhale. You're pulling in white light. Then you exhale through your mouth, visualizing sending golden light out through your heart in all directions, 360 degrees. So you end up sitting in a globe of golden light. And we'll do that. We have about 4 minutes left. Okay. Inhale through the nose. Light comes down to the heart. Exhale through the mouth. Light radiates out, and you're sitting in a globe of golden light. You do 2 more cycles and then sit quietly. Okay. So Janet will email you the handouts sometime today. And these are all wonderful calming practices. I hope you like them. And if you have any questions, well, I didn't put my email on the handout, but Janet has it. So if you have any questions later on, please feel free to get in touch with me. And I've been doing this for 55 years. I keep learning new practices, but I always go back to the ones that I like the most. And of course, it's different for anybody, for each person. So thank you for coming. Enjoy the rest of your day, snow or not. And actually, my son told me he saw a whole bunch of deer in his backyard in the snow, sticking their noses down to try to get something to eat. Anyway, so enjoy.
Thank you. Thank you, Eileen, so much. Janet reminds us that next week we're going to have Eliza Sharp, who's been with us for quite some time, and who's doing the wellness, I guess.
She is doing both, Misha.
Doing both. Great. So I'll see everybody then. I'll be doing Q&A as usual, and we'll have her do both wellness and the mind body.
Thank you, Eileen.
Thank
You're very welcome. Take care.
Go play outside. Snow fight. Snowball fight, everybody.
Have fun in the snow with your family, Misha.
Stay warm, everyone.
Bye.